When a blood clot detaches within the venous system and travels to the pulmonary artery, this condition, known as pulmonary embolism, PE, can be instantly fatal. Unfortunately, many people suddenly face the risk of serious complications or health decline simply due to a lack of knowledge about proper methods for maintaining and improving circulation in their lower limbs. This aspect is a fundamental element of overall well-being. Blood flows effectively into our legs thanks to the heart's rhythmic contractions and gravitational pull, which aids its downward movement through the arteries. However, the return flow of blood, its journey back to the heart through the veins, is significantly less efficient. This is because gravity, in this case, works against venous blood flow, tending to keep blood in the lower limbs. Furthermore, a modern lifestyle exacerbates this problem. An unbalanced diet, insufficient physical activity, and general neglect of foot care significantly impair venous outflow. All these factors create favorable conditions for blood stagnation, which, in turn, can lead to the development of serious vascular pathologies. Therefore, it is vitally important to regularly perform targeted physical exercises aimed at optimizing blood circulation and supply to the legs. These simple yet effective movements can significantly improve well-being and serve as excellent prevention for numerous problems. We will first focus on exercises for veins, then move on to arteries. One of the key causes of venous problems is physical inactivity, hypodynamia, or, conversely, prolonged static positions, which are common in many professions. When a person moves little, the calf muscles, which act as a second heart for the venous system, do not contract properly. This prevents venous blood from effectively returning to the heart. Blood stagnation in the veins of the lower limbs creates preconditions for clot formation and the progression of thrombophlebitis, inflammation of the vein walls with accompanying thrombus formation. As mentioned, a detached clot can have fatal consequences. Therefore, at the slightest suspicion of venous problems, it is imperative to promptly consult a phlebologist for qualified advice and diagnosis. Self-treatment in such cases is strictly prohibited and poses a threat. Many people experience discomfort, aching, or swelling in their lower limbs by evening and don't know how to alleviate this unpleasant condition. These symptoms often indicate impaired venous outflow and blood stasis. Fortunately, there is a set of highly effective exercises that can significantly improve blood circulation in the legs, bringing relief even in old age. Systematic performance of such exercises is an excellent preventive measure against various thromboses and other vascular pathologies. Imagine, you return home after a long day. Your legs feel noticeably tired, painful, and swollen. What actions can you take to optimize circulation, relieve pain, and reduce swelling? There is a wide range of effective exercises, and we will start with the most important and easy to perform ones. For the first exercise, you will need a small bolster or a rolled towel. It should be placed under your lower back, lumbar spine during the exercise. Lie on your back with the bolster under your lower back, and raise your legs onto a vertical surface, a wall, so they're fully straightened and securely resting on it. In this position, it is recommended to lie for at least a few minutes, promoting blood drainage from the legs. Then, while maintaining this position, begin the following movement. Slowly move one leg sideways, sliding it along the wall surface, and then just as slowly return it to the starting position. Repeat this movement 10 times for each leg. This exercise is designed for gentle stretching of the groin area, where large blood vessels are located. The inguinal triangle can sometimes be subject to compression, leading to impaired blood flow in the lower limbs. By performing these abduction movements, you delicately stretch this area, stimulating optimized circulation in the lower limbs. This helps venous blood return more effectively to the heart, reduces swelling, and brings a significant feeling of relief and lightness in the legs. The second exercise is performed similarly to the first, also with your legs raised on the wall. Slowly move one leg sideways, ensuring maximum opening of the hip joint, and then slowly return it to the starting position. It is crucial to perform this movement without sudden jerks, maintaining full control over each segment of the movement, so that your lower back remains in firm contact with the bolster and does not lift off the floor. Repeat this exercise 10 times for each leg. After this, perform an identical movement, but with both lower limbs simultaneously. Smoothly spread your legs sideways within a comfortable range, and then slowly bring them back together. For additional stability, you can extend your arms out to the sides. This movement also effectively targets the groin area, aiding in optimizing venous outflow and relieving muscle tension. Next, we move to the third simple but very effective exercise. While in the same position with your legs on the wall, bend one lower limb at the knee joint and pull it towards your torso, sliding the sole of your foot along the wall surface. Then smoothly return the limb to its original straightened position. To ensure optimal sliding of the foot along the wall, it is recommended to wear socks. Perform this movement 10 times for each leg. After this, do the following. Move the bent limb sideways, then return it to the starting position, and then straighten it. This movement is also performed 10 times for each leg, contributing to increased hip joint mobility and further activating blood circulation. To conclude the series of wall exercises, perform the following movement. Gently bend both lower limbs at the knees, pulling them towards your torso, and then slowly straighten them, sliding your feet along the vertical surface. This movement is performed with both legs together. Then, perform rotational movements with your feet in various directions, 10 times in one direction and 10 times in the other, rotating at the ankle joints. Even if you dedicate just 5 minutes to these exercises every evening, especially when your lower limbs feel tired after daily activity, you will experience significant relief and a feeling of lightness. Swelling may even decrease. This is an effective and easily accessible preventive measure against venous thromboses, which will help maintain the health of your lower limbs for many years. Consistency and systematic practice play a key role here. In addition to the demonstrated physical exercises, which are particularly beneficial in the evening hours when legs are tired after the day, it is critically important to recognize the significance of the triceps shurai muscle, calf muscle group, which the scientific community often refers to as the second heart. When a person walks, the calf muscles contract, and this contraction functions like a pump, ensuring the upward propulsion of venous blood towards the heart, overcoming gravitational pull. This is why daily walking in an adequate amount is one of the most accessible and effective methods for maintaining venous health. There is no need for exhausting physical exertion or marathon running. Regular, systematic walking can eliminate a significant number of venous problems. The contraction of the calf muscles during walking actively assists the veins in moving blood, thereby substantially reducing the risk of clot formation. This is an easily accessible and natural mechanism for maintaining venous health. Blood clots pose an exceptionally serious danger to health and life. You may have heard of cases where a loved one suddenly died due to a detached clot. It is important to clearly distinguish between clots forming in the arterial system and those in the veins. Arterial clots, when dislodged, can cause a stroke if they migrate to brain vessels, or a heart attack if they occlude coronary arteries of the heart. Venous clots, when dislodged, primarily migrate to the pulmonary artery, causing pulmonary embolism, PE. If the thrombotic mass is large, it can lead to immediate death. Smaller thrombotic masses can cause various negative manifestations and a general decline in well-being, but they also require emergency medical attention. At the slightest suspicion of thrombosis, such as sharp pain, pronounced swelling, or a change in the skin color of a leg, you should immediately contact emergency medical services. If, upon waking in the morning, a person discovers that one of their calves is swollen, has an abnormal color, bluish or reddish, or feels painful or aching, it is strictly forbidden to attempt massage or active walking. These actions can provoke the dislodgement of the thrombotic mass, which carries extremely tragic consequences. The only correct action in such a situation is to immediately call an emergency medical team. Medical professionals can correctly assess the clinical picture and take all necessary steps to prevent pulmonary embolism and its further migration to the pulmonary artery. It should be remembered that intense physical activity or improper massage in the presence of a clot poses a deadly threat. The primary task is to ensure absolute rest for the affected limb and promptly receive qualified medical support. In addition to the physical exercises demonstrated, which are particularly beneficial in the evening hours when the lower limbs are tired after daily activity, it is necessary to maintain an overall level of physical activity. It is recommended to take at least 6,000 steps daily to maintain optimal venous system health. This helps maintain calf muscle tone and ensures proper venous outflow. To alleviate discomfort and optimize blood supply to the lower limbs, especially in the calf area where the triceps shurai muscle, consisting of the gastrocnemius and soleus muscles, is located, specialized massage techniques have been developed. The gastrocnemius muscle has two heads, while the soleus muscle, which is flat, lies deeper. These muscles are often the source of pain that can radiate to the knee joint, creating a false impression of a problem specifically in the joint. Certain exercises and massage techniques exist to relieve hypertonicity in these muscles. However, it is extremely important to remember, if you have varicose veins with pronounced bulging veins, these exercises and massage are strictly contraindicated, as they can worsen the pathological condition. In the absence of varicose veins, these methods can be very effective. The first step is to perform a massage of the gastrocnemius muscle. Its technique is quite simple. You should grasp the calf with both hands and gently but firmly knead the muscle, moving from the ankle towards the knee joint. Do not apply excessive pressure. The movements should be stroking and kneading. It is recommended to perform this massage for several minutes. You will immediately feel pleasant relaxation and lightness in your legs. It is advisable to dedicate 1 minute to each lower limb, working the muscle from various sides. This massage helps improve local blood circulation and relieve muscle tension, which is especially valuable after a long day. Next, we move on to working the soleus muscle, which is located deeper between the tibia and fibula beneath the gastrocnemius muscle. For its massage, you can use a specialized massage ball, which should not be overly hard, but rather soft. Place the ball under your calf and, by rolling it, work the muscle, applying moderate pressure. If a massage ball is unavailable, the soleus muscle can be massaged with your hands. To do this, grasp the calf with both hands, placing your thumbs on either side of the tibia, and knead the muscle, moving along it. In some spots, painful sensations may arise. These are so-called trigger points, requiring special attention. Gently massage these points with soft, circular motions until the pain subsides. Similar actions should be performed on the other side of the calf, focusing on the area between the gastrocnemius and fibula. This massage significantly improves blood circulation in the deep layers of the calf muscles, relieves tension, and contributes to the overall health of the legs. Thus, with the help of these exercises and massage techniques, problems related to veins are effectively addressed. This is an excellent prevention for lower limb venous thrombosis. It is recommended to perform these exercises in the evening, after returning home, directly before sleep, to relieve daily fatigue and improve venous outflow. Throughout the day, one should strive for a sufficiently active lifestyle, walk more, and avoid prolonged sitting or standing. Extended periods in a static position create excessive pressure on the valves and the veins, which can lead to their weakening and impaired blood flow. Activity, on the contrary, helps keep these valves functioning, reducing the risk of clot formation. In addition to veins, it is extremely important to pay due attention to arteries. Problems with arteries can be no less, and sometimes even more, dangerous than with veins, and can also lead to serious health consequences. Arteries are vessels through which oxygen-rich blood flows from the heart to all organs, muscles, and, of course, the lower limbs. What is important to know about arteries? If a person's arteries are clogged with cholesterol plaques, this can provoke serious health problems known as atherosclerosis. What should you pay attention to in order to recognize the symptoms of arterial occlusion? One of the first signs is persistently cold feet, even in warm weather. If a person constantly feels the desire to wear socks to warm their feet, this can be an alarming signal. Why is it so important to know if arteries are clogged with cholesterol? Because atherosclerotic plaques can narrow or completely block an artery to such an extent that blood supply to a certain part of the limb, for example, the foot, ceases. This condition is called ischemia, in which muscles and tissues experience an acute deficiency of oxygen and nutrients. Lower limb ischemia is an extremely dangerous condition that, unfortunately, often results in amputation. You have probably seen people, especially smokers, who in old age use wheelchairs due to leg amputations. Smoking is one of the most powerful factors contributing to the intensive formation of cholesterol plaques in the arteries and the development of severe ischemia. What other symptoms might indicate arterial problems? In addition to persistently cold feet, pay attention to the sudden disappearance of hair on the legs, especially in men. If the legs were previously hairy and now hair has started to fall out, this could be a sign of impaired blood supply. Another symptom is changes in the nail plates. For example, if the nails on one leg look normal, but on the other they have started to crumble, turned yellow, or even blackened, this is a very alarming sign. Changes in the color of the skin on the legs are also an important sign. If the legs were a healthy pink color but suddenly turned bluish, pale, or developed areas of redness accompanied by swelling, this requires attention. Pain in the legs that occurs both at rest and during walking, as well as at night, numbness and cramps, can also indicate arterial problems. Special attention should be paid to what is known as intermittent claudication. This is a condition in which leg pain, most often in the calves, sometimes in the thighs or buttocks, occurs after walking a certain distance, e.g., 100 to 200 meters, and subsides after a short rest. Intermittent claudication indicates that the arteries are so clogged with cholesterol that during physical exertion, the working muscles do not receive enough oxygen and nutrients. Ischemia occurs, which manifests as severe pain. In such cases, it is necessary to urgently consult a doctor. If a person suspects problems with the arteries of the lower limbs, they should consult a vascular surgeon. The vascular surgeon will conduct the necessary examination, such as an ultrasound of the arteries, which will allow visualization of the vessels and determination of the presence and size of atherosclerotic plaques. Based on the data obtained, appropriate treatment will be prescribed. It is extremely important not to delay a visit to the doctor, as timely diagnosis and initiation of treatment can prevent serious complications. If you do not see a doctor in time, do not undergo an ultrasound, and do not start taking the prescribed medications. This can lead to irreversible consequences up to the amputation of part of the leg, a toe, foot, or even a higher level. People with risk factors should pay special attention to this problem. The most serious risk factor contributing to cholesterol occlusion of the lower limb arteries is smoking. Nicotine and other toxic components of tobacco smoke cause inflammation of the inner lining of the arteries, which facilitates the formation of atherosclerotic plaques. Also at risk are people with elevated levels of bad cholesterol, low-density lipoproteins. Excess body weight, diabetes, and physical inactivity also significantly increase the risk of developing arterial atherosclerosis. Alcohol abuse can also negatively affect the condition of blood vessels. When arteries become clogged with cholesterol to a critical level, not only medication, but also surgical intervention may be required to save the limb. People often wonder how to determine the presence of plaques in arteries, especially if access to a doctor is limited, for example, in rural areas. It is understandable that such situations occur, but it should be emphasized again, self-treatment is unacceptable. However, if a person wishes to get a preliminary idea of the condition of their arteries, there is a method that can be performed at home, although its accuracy may be low without professional equipment and skills. This test is called the ankle brachial index, ABI. An electronic blood pressure monitor is required for its performance. First, arterial pressure is measured at the ankle. For this, the blood pressure cuff should be placed on the calf, slightly above the ankle. The measurement should be taken in a lying position, as readings may be inaccurate in a sitting or standing position due to hydrostatic pressure. It is desirable for someone to assist with the measurement, as it is quite difficult to do alone. To increase accuracy, it is recommended to take several measurements, e.g., 3, with an interval of several minutes, and take the average value. It is necessary to ensure that the blood pressure monitor used is of good quality and automatic. Rest during the measurement is extremely important for obtaining reliable figures. After measuring the pressure on the right ankle, the pressure on the right arm is measured, also using a blood pressure monitor. It is important to measure arm pressure correctly, following generally accepted rules. Do not smoke or eat before the measurement. Be at rest, sitting on a chair with a backrest. 3 measurements should be taken, and the arithmetic mean between the second and third readings should be used, discarding the first. Then, measurements are repeated on the left ankle and left arm. To calculate the ankle brachial index, ABI, the highest systolic upper pressure obtained at the ankle from both legs is taken and divided by the highest systolic pressure obtained at the arm from both arms. A normal ABI value is usually in the range of 0.9 to 1.3. If the obtained figure is significantly below 0.9, for example, approaching 0.4 or lower, this may indicate severe arterial damage and a high risk of limb loss. This is very alarming and sad, as many elderly people ignore such signs as skin darkening on the leg and seek medical attention too late, when it is no longer possible to save the limb due to lack of blood supply. Therefore, this method of determining the ankle brachial index, ABI, should be used not for self-treatment, but as a tool for preliminary assessment of the situation, especially when immediate access to a medical specialist is not possible. It is strongly recommended to acquire a quality blood pressure monitor and periodically monitor ankle blood pressure to be aware of the condition of your blood vessels. In conclusion, from all of the above, it is clear that a comprehensive approach to the health of the lower limbs and the entire cardiovascular system is extremely important. It is crucial to carefully monitor the condition of your veins, preventing blood stagnation. You need to walk a lot, adhere to a balanced diet, and completely quit smoking. However, it is equally important and sometimes more challenging to pay attention to arterial health. If a person has high risk factors, such as smoking, a sedentary lifestyle, excess body weight, diabetes, or if their close relatives, parents, grandparents, had early cardiovascular diseases, e.g., heart attacks or strokes before age 60, then there is likely a genetic predisposition. In such a case, it is absolutely necessary to check cholesterol levels and undergo other diagnostic examinations prescribed by a doctor to start arterial therapy in a timely manner. It should be remembered that if atherosclerotic plaques are found in the leg arteries, they are most likely also present in other vital vessels, such as the carotid arteries, which increases the risk of stroke, and the coronary arteries of the heart, which increases the risk of heart attack. Problems with lower limb vessels often serve as an indicator of systemic atherosclerosis. Cardiovascular diseases are the leading cause of death worldwide, including ischemic heart disease, myocardial infarctions, strokes, and pulmonary embolism. Therefore, take care of yourself, take care of your loved ones, and pay due attention to your legs and your entire body. Remember that physical exercises can serve as excellent prevention, but they are not a method of treating serious diseases. If health problems arise, always consult qualified specialists, a phlebologist for vein problems and a vascular surgeon for artery problems. Only evidence-based medicine can provide effective treatment. Take care of yourself, and you will live long, happily, and feel great. In addition to physical activity and timely medical consultation, proper nutrition plays a huge role in maintaining vascular health. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins helps lower bad cholesterol levels and maintain the elasticity of blood vessel walls. Foods containing antioxidants and omega-3 fatty acids, such as fatty fish, nuts, and seeds, are especially beneficial as they have anti-inflammatory properties and help improve blood flow. Adequate hydration is equally important. Dehydration leads to blood thickening, which increases the burden on the heart and hinders its circulation through the vessels. Regular consumption of clean water throughout the day helps maintain optimal blood viscosity, facilitating its movement through veins and arteries and reducing the risk of clot formation. This is a simple but often underestimated factor in vascular health. For individuals prone to venous problems or already showing early signs of varicose veins, the use of compression hosiery may be recommended after consulting a doctor. Special stockings or socks create graduated pressure on the legs, maximal at the ankle and gradually decreasing towards the thigh. This helps support the veins, improve venous outflow, and prevent blood stagnation, significantly reducing swelling and discomfort. Another simple and effective way to relieve leg discomfort after a long day is to elevate them. Raising your legs above heart level for 15 to 20 minutes several times a day promotes blood drainage from the lower limbs, reduces swelling, and relieves fatigue. This is especially beneficial for those who spend a lot of time standing or sitting and is an excellent complement to the exercise routine. Finally, do not forget about regular preventive medical checkups, even in the absence of obvious symptoms. Early detection of risk factors and initial changes in blood vessels allows for timely intervention and prevention of serious diseases. This is especially true for people with a genetic predisposition or other chronic conditions such as diabetes or hypertension, which significantly increase the risk of vascular pathologies. Remember that caring for your blood vessels is an investment in your longevity and quality of life. A comprehensive approach, including physical activity, proper nutrition, adequate hydration, as well as attentive listening to your body's signals and timely consultation with specialists, will help maintain the health of your legs and entire body for many years. A person's well-being is in their own hands. Delving deeper into the topic of proper nutrition, it should be noted that it is a cornerstone of vascular health. To maintain arterial elasticity and prevent the formation of cholesterol plaques, it is crucial to minimize the consumption of saturated and trans fats, which are found in red meat, fatty dairy products, fast food, and many processed foods. These types of fats contribute to an increase in bad cholesterol levels in the blood, which is directly linked to the development of atherosclerosis. Instead, preference should be given to foods rich in unsaturated fats, such as avocados, olive oil, nuts, and seeds. They contain beneficial fatty acids that help lower cholesterol levels and possess anti-inflammatory properties. Including fatty fish like salmon, mackerel, or sardines in your diet will provide your body with valuable omega-3 fatty acids, which support cardiovascular health and improve blood flow. Special attention should be paid to fiber intake. Foods rich in dietary fiber, whole grains, legumes, fruits, and vegetables help bind cholesterol in the intestines and remove it from the body. This helps maintain healthy lipid levels in the blood and prevents plaque formation on arterial walls. Regular fiber consumption also promotes normal digestion and helps maintain a healthy weight. Controlling sodium, salt, intake also plays an important role in preventing vascular diseases. Excess salt in the diet can lead to increased blood pressure, which puts additional strain on blood vessel walls and contributes to their damage. You should try to reduce your consumption of processed foods, canned goods, and ready-made sauces, which often contain a hidden large amount of sodium. Instead, it is recommended to use natural spices and herbs to flavor dishes. Antioxidants found in colorful fruits and vegetables, such as berries, dark green leafy vegetables, citrus fruits, and tomatoes, protect vascular cells from free radical damage. They help maintain the integrity of the endothelium, the inner lining of blood vessels, which plays a key role in regulating blood flow. In addition to nutrition, sufficient hydration is extremely important. Pure water is essential for maintaining optimal blood viscosity. When the body is dehydrated, blood becomes thicker, which makes it harder for it to move through the vessels and increases the risk of clot formation. You should try to drink enough water throughout the day based on your individual needs and level of physical activity. It is necessary to avoid excessive consumption of beverages that can contribute to dehydration, such as coffee, strong tea, and sugary carbonated drinks. Although they contain fluid, their diuretic effect or high sugar content can negatively affect the body's water balance. Preference should be given to pure water, herbal teas, and freshly squeezed juices without added sugar. Weight management is another critically important aspect of vascular health. Excess body weight, especially abdominal obesity, fat accumulation in the abdominal area, creates additional mechanical pressure on the veins in the abdominal cavity, hindering blood flow from the lower limbs. This increases the risk of varicose veins and venous stasis. Furthermore, obesity is often associated with metabolic disorders such as insulin resistance, type 2 diabetes, and dyslipidemia, impaired lipid metabolism. These conditions directly contribute to the development of atherosclerosis, inflammation of arterial walls, and the formation of cholesterol plaques. Maintaining a healthy weight significantly reduces the burden on the cardiovascular system and improves overall circulation. Returning to unhealthy habits, it is necessary to re-emphasize the destructive effect of smoking on blood vessels. Nicotine and thousands of other toxic substances contained in tobacco smoke directly damage the inner lining of the arteries, the endothelium. This damage makes the blood vessel walls more susceptible to cholesterol deposition and the formation of atherosclerotic plaques. Smoking also causes blood vessel constriction, vasoconstriction, which leads to increased blood pressure and reduced blood flow to tissues. Smokers have a significantly increased risk of developing intermittent claudication, heart attacks, strokes, and limb amputations. Quitting smoking is one of the most effective steps to improve vascular health and reduce the risk of cardiovascular catastrophes. As for alcohol, moderate consumption may not have a significant negative impact on blood vessels, and in some cases, it is even associated with a small reduction in the risk of cardiovascular diseases. However, excessive and regular alcohol consumption, on the contrary, can lead to increased blood pressure, damage to the heart muscle, alcoholic cardiomyopathy, and impaired lipid metabolism. It is important to exercise moderation and not exceed recommended limits. Chronic stress also has a significant negative impact on the cardiovascular system. Under stress, the human body produces hormones such as cortisol and adrenaline, which cause blood vessel constriction, increased blood pressure, and an accelerated heart rate. Prolonged exposure to these hormones can contribute to the development of inflammatory processes in the blood vessels and accelerate the progression of atherosclerosis. Therefore, it is extremely important to master effective stress management methods. These can include breathing exercises, meditation, yoga, regular outdoor walks, engaging in a favorite hobby, or simply setting aside time for adequate rest and relaxation. Effective stress management helps reduce the burden on the cardiovascular system and contributes to overall well-being. Choosing the right footwear and maintaining an adequate posture also significantly influence blood circulation in the lower limbs. Tight shoes, high heels, or flat-soled shoes without sufficient arch support can disrupt natural blood flow and create excessive pressure on certain areas of the foot and calf. This can lead to fatigue, swelling, and even exacerbate venous problems. Preference should be given to comfortable, breathable footwear with good cushioning and arch support. It is necessary to avoid prolonged sitting with crossed legs, as this compresses blood vessels and hinders blood flow. If your professional activity involves prolonged sitting or standing, you should try to regularly change your body position and take short breaks for stretching. Regular short breaks for movement throughout the day are of great importance. If a person works in an office, they should try to stand up and stretch every 30 to 60 minutes. Simple exercises such as circular foot movements, calf raises, or a short walk down the hallway will help activate the calf muscles and improve venous outflow, preventing blood stagnation. These micro-exercises are especially important during long journeys, for example, on a plane or in a car. Prolonged immobility significantly increases the risk of deep vein thrombosis. Therefore, during travel, you should try to regularly stand up, walk around the cabin, or perform leg exercises in place. Constant monitoring of key health indicators is an integral part of preventing vascular diseases. Regularly measure your blood pressure, even if you feel well. High blood pressure, hypertension, often proceeds asymptomatically, but it constantly damages arterial walls, making them stiff and vulnerable to atherosclerotic plaques. Blood sugar control is critically important, especially for people with diabetes or a predisposition to it. High blood glucose levels damage both large and small blood vessels, macro and microangiopathy, leading to serious complications, including problems with the legs, kidneys, eyes, and heart. Regular blood tests for glucose and glycated hemoglobin will help keep the situation under control. It is also important to regularly check your blood lipid profile, which includes total cholesterol, low-density lipoproteins, LDL, bad cholesterol, high-density lipoproteins, HDL, good cholesterol, and triglycerides. These indicators provide a complete picture of lipid metabolism and allow for the assessment of atherosclerosis risk. Quality sleep plays a fundamental role in body recovery and maintaining cardiovascular health. During sleep, cell regeneration occurs, blood pressure normalizes, and stress hormone levels decrease. Lack of sleep, on the contrary, is associated with an increased risk of hypertension, obesity, diabetes, and inflammatory processes that negatively affect blood vessels. You should try to stick to a regular sleep schedule, create comfortable conditions for rest, and avoid using gadgets before bed. Sufficient and quality sleep is not a luxury, but a vital need for maintaining the health of the entire body, including blood vessels. Beyond obvious symptoms such as pain and swelling, it's important to pay attention to more subtle signs of impaired circulation in the legs. These can include skin changes. It might become thinner, shinier, drier, or, conversely, pigmentation might appear. Slow healing of even small wounds or scratches on the legs is also an alarming sign, indicating insufficient blood supply. Hair loss on the legs, changes in nail color, yellowing, thickening, brittleness, or their slow growth can also be signs of arterial problems. A feeling of coldness in one leg compared to the other, numbness, tingling, or pins and needles without an obvious cause, as well as nocturnal muscle cramps, especially in the calves, require attention and specialist consultation. Regular self-examination of the legs will help detect these changes at an early stage. Psychological well-being also influences the course of chronic diseases, including vascular pathologies. Depression and anxiety disorders can reduce motivation to follow doctors' recommendations, maintain a healthy lifestyle, and take medications regularly. It is important not to hesitate to seek psychological support if you feel overwhelmed by the emotional pressure associated with illness. Support from loved ones, participation in support groups, or consultations with a psychologist can significantly improve quality of life and contribute to more effective health management. It should be remembered that emotional state is inextricably linked to physical state, and caring for mental health is part of a comprehensive approach to well-being. Once again, it should be emphasized, under no circumstances should you self-medicate. The information presented here is for informational purposes only and cannot replace professional medical advice. At the slightest suspicion of problems with veins or arteries, or if alarming symptoms appear, you must immediately consult a doctor. Only a qualified specialist can make an accurate diagnosis and prescribe adequate treatment based on the principles of evidence-based medicine. The exercises discussed are excellent for prevention and can alleviate some symptoms, but they cannot cure serious diseases such as thrombosis or severe atherosclerosis. In such cases, complex treatment is required, which may include medication, physiotherapy, or even surgical intervention. Your task is to be attentive to your body and seek help in a timely manner. Take care of yourself, take care of your loved ones, and pay due attention to your legs and your entire cardiovascular system. A proactive approach to health, based on knowledge and cooperation with medical specialists, will allow you to live long, happily, and feel great, enjoying every movement. Delving deeper into the topic of proper nutrition, it should be noted that it is a cornerstone of vascular health. To maintain arterial elasticity and prevent the formation of cholesterol plaques, it is crucial to minimize the consumption of saturated and trans fats, which are found in red meat, fatty dairy products, fast food, and many processed foods. These types of fats contribute to an increase in bad cholesterol levels in the blood, which is directly linked to the development of atherosclerosis. Instead, preference should be given to foods rich in unsaturated fats, such as avocados, olive oil, nuts, and seeds. They contain beneficial fatty acids that help lower cholesterol levels and possess anti-inflammatory properties. Including fatty fish like salmon, mackerel, or sardines in your diet will provide your body with valuable omega-3 fatty acids, which support cardiovascular health and improve blood flow. Special attention should be paid to fiber intake. Foods rich in dietary fiber, whole grains, legumes, fruits, and vegetables help bind cholesterol in the intestines and remove it from the body. This helps maintain healthy lipid levels in the blood and prevents plaque formation on arterial walls. Regular fiber consumption also promotes normal digestion and helps maintain a healthy weight. Controlling sodium, salt, intake also plays an important role in preventing vascular diseases. Excess salt in the diet can lead to increased blood pressure, which puts additional strain on blood vessel walls and contributes to their damage.